go through and do a brief introduction to our panelists for this evening. First up, we have Gaurav. He is a validation engineer at CAI, and I believe you graduated in 2018, right? I'm not wrong in that. I just kind of guesstimated. I think I remember
I think
that.
it was 2019,
Oh.
but I don't remember either. I think
It's
it was
not that
2019.
important.
I think it was spring 2019. Yeah.
Okay. And then next up we have Margaret Carpenter. If y'all were here last year, you might remember her and Cale as well. They were both previous officers from the past year. And Margaret is an OEM engineer at Millar Incorporated, and she graduated last year. And Cale is a research assistant in neurosurgery at UTHealth, and he also graduated last year as well. And so we'll probably just go ahead and go in this order. So Gaurav, Margaret, and Cale, and then we'll start with the first question. So Gaurav, where are you employed? What's your job description, and what do you do on a day-to-day basis?
So yeah, hi everybody. My name is Gaurav. I did graduate in 2019. I had to look it up. It was spring 2019. So currently I'm employed in Daytona Beach, Florida. I'm a validation engineer with CAI. So my job, I guess in one sentence, is I inspect and test equipment and automation and personnel, as well as the process um, to document that supports the claim that our process is competent enough to consistently produce a quality product. I kind of strayed away from the medical device side for this job, so I'm actually in the pharmaceutical side. So I'm working at like a pharmaceutical plant when we're making like saline solutions for IV bags. So right now, I'm pretty early on for this job. I just started this job in early January, so only about 2 months now. Currently, I am just making sure that everything is installed and operating correctly. So I don't know if you guys, I doubt you guys have ever been to like a plant, but it's a lot of like piping, valves, instrumentation, like which reads pressure and temperature, conductivity. So just making sure everything's installed correctly and everything is operating correctly. Because at the end of the day, you're not really trying, you want to make your boss happy, but in reality, you're just trying to make the FDA happy. So there's a lot of like small things they're looking for based on their guidelines that allow you to sell a product to the market. So people install the stuff, but at the end of the day, I'm the guy who goes in and I'm the last set of eyes that's actually on all the equipment to make sure that it's functioning as it should be and meets all our requirements.
All right, awesome, thank you. Next up, Marco.
Okay, so hi, I am Margaret, or as Reagan sometimes calls me, Margot. That's my nickname. I go by that a lot. So I'm employed at Millar. It's actually a medical device company here in Houston. It is really just a couple miles south of campus, which is super convenient. But OEM basically stands for Original Equipment Manufacturer. So my job description is basically making new things, which is exactly what it sounds like. My company in general focuses on like pressure sensors, and they're very like micro. And the largest one we work with is 1 millimeter. And so we install them in like pressure sensing catheters used for cardiac procedures or like intracranial pressure, even like compartment syndrome. And so what we do on the OEM side is we work with outside companies. So other medical device companies can come to us and we can design a device for them with our pressure sensors in their device. And so basically my job is we go from basic like idea all the way through proof of concept, prototyping, and then we see it through to like manufacturing and then clinical. So we get to do a little bit of everything, a lot of paperwork involved, which is not so fun, but we do get to do the really fun design stuff too. So, yeah.
All right, awesome, thank you. And then next up we have Cale.
Hey, I'm Cale. I work for UTHealth, and I work over in the med center at the UTHealth Med School. Um, I am a research assistant in the neurosurgery department, and so basically what I do is my main function is we get epilepsy patients who come to the hospital and they get these electrodes implanted in their brains, trying to figure out where their seizures are originating from. And so while they have these electrodes in their brains, it's a really unique opportunity to learn about what's going on in the brain, because there's not a whole lot of people sitting around with like these aren't just surface electrodes or like scalp EEG or anything. This is like actual probes that are sticking down inside their brain. So it's a super unique opportunity to get really precise like spatial data. So they're constantly being recorded while they're in the hospital. And so I go and I do tasks on the computer with them. So things like picture naming, like face naming, like naming famous people, just a bunch of things like that, just to learn exactly what, which parts of the brain are responsible for all these different functions. And then I also get to, a lot of these patients will eventually go on to have surgery to remove the part of the brain that is causing their seizures. And so I get to go to the OR a lot. I was in there yesterday for most of the day, and I build these models of like where exactly in the brain their tumor or their epilepsy is, or sometimes for tumor patients, I can build a model of their tumor, and I get that all prepared for the neurosurgeon that I work for, and he uses that kind of as a guide to know where exactly he needs to be cutting and not cutting and things like that. So I get to do a lot of super cool stuff. It's not necessarily like one job description that I have. It's kind of a bunch of random stuff like that, but it's really cool.
Awesome. That is really cool. So we're going to start with Gaurav again. What led you to your current place of employment, or like how exactly did you go ahead and get your job?
So yeah, like I said, I graduated in 2019, and I went to grad school at A&M, and then they had a biomedical engineering career fair. So I had like 2 internships that dealt with verification and validation testing for medical devices. So it was kind of a nice fit for me.
Awesome. Really cool. Really cool. Margaret.
I actually got my job through an internship. I started interning at Millar the summer before my senior year in May of 2019. And then they kept me on as an intern through my senior year, and then transitioned me to full-time employment after I graduated. So
Cool. And then Cale.
I met someone from UTHealth at a career fair and told them kind of what I was interested in, what I was looking for, and they just pointed me in this direction. And then this was all happening like right when the pandemic started, so this was like the only offer that I got before everything shut down. So I took it.
Yes, definitely a smart choice. All right, and then to the next question. All right, and then with Gaurav, how do you think your undergraduate education prepared you for your job, or if it did at all?
Yeah, I feel kind of bad to say this, but even through grad school, I think there was maybe one class in grad school that was slightly applicable to what I'm doing now. I think college, you learn how to learn, but that's about it. You don't really, like, the classes that you're taking, they're not super helpful. You can do DiffyQ, but at the end of the day, you're going to be doing Excel. Like, just how it is.
That definitely makes sense. All right, and Margaret?
yeah, I mean, there are like a couple of classes that I really like, like use the material, but the vast majority of them is just kind of like, like, like cool, I know that, but never gonna need it again. But really, yeah, it just kind of teaches you to learn quickly and kind of like adapt to a bunch of different scenarios. And then, because biomed education is so broad and diverse, you do kind of get that in, I mean, depending on your job, of course. But with my job, like I have to go through like the entire process. And so like I deal with like materials and a little bit of the mechanical stuff and the electrical. And so like, you know, I have a little bit of knowledge that I can at least make my way through all of those different areas.
Yeah, that's
So,
good. It helps to definitely at least get a foot in the door for everything.
yes.
All right, thank you.
I would say my job is not really engineering related at all, at least what I'm doing right now. But I know, like, just having experience, like Margaret was saying, just in a lot of different things, so that, like, even if I don't really know much about something, at least I've heard of it before, and I kind of know the idea around it or something. And also, like, we use MATLAB, and obviously MATLAB's a big thing in undergrad, BME stuff. So that was pretty helpful. But yeah, kind of like both of Gaurav and Margaret were saying, that it's mostly just learning to learn and being able to just figure out what you need to do and time management and all that kind of stuff. It's not necessarily what you had on a particular test. It's just like the whole process of going through everything.
Definitely. All right, cool. Next question. So Gaurav, what was your favorite class in undergrad and why? It doesn't have to be even anything BME related, just like a fun little question.
No, honestly, I think it was instrumentation with Inche. I just really liked him. Like, I just liked a good professor. He was fun. He was funny. So that was probably my favorite class in undergrad.
Cool, cool. Margaret.
I actually really enjoyed circuit analysis, both 1 and 2. I know that's a bit for a lot of BME majors, but I actually really enjoyed it. And part of the reason why I enjoyed it was because it was one of the few classes where I actually like super felt like I was really like retaining all of the information that I was learning. It wasn't just like cram for a test and then forget it. I felt like I was actually like learning the material, and it kind of introduced me to something I had no experience with. I had zero knowledge of circuits going into it. But I came out of that class and it kind of like redirected what I was thinking as my career path. Because I was thinking, you know, like, oh, I like biology and no, maybe I'll go do research. And then I took this class and figured out I was good at circuits and I enjoyed it a lot. And now I'm in medical devices. So completely changed my course.
That's awesome. That's really cool. All right, and Cale.
I would say probably biomedical micro devices. That was a super interesting class for me. I think Dr. Horton's a pretty polarizing professor. Some people love her, some people hate her. I just thought it was a super interesting class. I don't know who teaches it now, but that was super cool. And then biomaterials was another one that I also enjoyed. That was not necessarily the coursework, because all it was just reading papers and doing presentations over papers, but a lot of the stuff that we got to read about and learn about that's pretty interesting. Dr. Maj teaches micro devices now. That's cool. I like Dr. Maj. She's probably good at that class.
So cool. All right, next question. Gaurav, what advice would you give to your younger self as an undergraduate? Or technically speaking, even to some of the undergraduates here.
Yeah, stop stressing so much. Like, things will work out. I promise you. Everybody, like, I know for the longest time, like, everything was just about like get a job. Everybody gets a job. Like, you don't. I don't know. I stressed a lot in undergrad, even in grad school. I was stressing all the time about like, okay, like, but it's going to happen. You don't need to worry about it as much as you think you do. That's just my humble opinion.
Awesome. Margaret.
Okay.
Bless you.
Honestly, I would say get out and just like enjoy time with your friends, explore the city. Like don't focus so much on your classwork. And not that like you shouldn't, you know, do your classes and try to make good grades, but what you're going to remember about your college career is not, oh, I made a 98 on this test. You're going to remember the fun times with your friends and the memories that you can make. And I mean, like, Houston's a cool city from what I know of it, but I've lived here 5 years and I barely know any of it because when I was in college, all I did was college. And, you know, and I kind of have like minor regrets about that now. So, you know, take your friends, go on a weekend little excursion, you know, just do something other than school all the time.
Awesome. Great advice. And then Cale.
I second both of those. Definitely, those are great. Those are great things to think about. I'd also say I know that it's really hard now that like the pandemic's still going on and everything, and career fairs probably aren't much of a thing. But like getting out and meeting people, and even just like attending things that you might not even have any interest in. Like I never went to a career fair until my senior year, and I never wanted to do research, and I never did research in undergrad. I never worked in anyone's lab, and I just like started talking to this person from UT, and then now I have a job and stuff. Like I know that it's kind of cliched about everyone always says like network and go meet people and stuff, but it's really important just to put yourself out there, and you've done all this work and you've gone to school for however many years, and now you need to figure out, you know, you need to, even if you know everything, you have to know someone to make any use of it, to get a job out of it or anything. So I'll definitely say, even if you're shy or hesitant or whatever, you just have to do it. That's pretty much all it comes down to.
It's definitely. I am kind of in the same boat where I've never done research. I've never really gone to many career fairs. So that's, I feel you on that one with the, for sure. Okay. And then we're rounding up on the final question here. What advice would you give to someone interested in your field that you wish you had, or you feel like is a little piece of advice that would just be good to have in general?
So yeah, my little piece of advice would be, like, for this job specifically, like, don't skip steps, you know, like, it might be more efficient, but like if you skip the little details, your product's gonna come out bad. Because at the end of the day, for my job, I'm the one who's signing things off. So like it's legally binding. So if I skip a step and I say something's there or something's validated and it's not, like worst case scenario, if I get super unlucky, I'm going to prison for it. So it's like the stakes are kind of high. So you can't cut corners. It's very like cut and dry about you did the work or you didn't do the work. So always do the work. Don't skip steps. Don't cut corners.
Yes, I would second you on that one. That's a all right, definitely. And Margaret, I just fused the two together.
Whichever. Any rendition of the name Margaret, I promise I'll probably answer to it. But I mean, my advice would be just to branch out a little bit. Like, yes, you have your BME coursework, and I get that it's extensive and it's exhausting, and they try to kill us with a million freaking classes. But if you find like an area that you might be interested in, go take classes outside just BME department. Try electrical, try mechanical, try business if you want to go down that route. But it's easier to know what you want whenever you expose yourself to a lot of different things. And it doesn't even necessarily have to be through your classwork. You know, you could just join a couple of different organizations other than just BMES, you know, try your different engineering organizations, go join a business one. Join an arty one if you want to do arts. I mean, just expose yourself to as much as you can, because that's those experiences and that kind of, knowledge, you can't replace that. So it's always good to just do as much as you can, even when you're tired. I mean, it'll work out.
Yes, definitely. It always does. All right. And Cale.
I don't really know what field I would put myself in, or to give advice to someone in a particular field, but and I'm getting a lot of experience in like a hospital setting, a lot of experience working with patients and stuff like that. So I feel like if there's anyone that's interested in pre-med stuff or working one-on-one with patients and not necessarily the straight like engineering kind of stuff, I think research settings through UTHealth, or not even necessarily UTHealth, but somewhere that's around a hospital, is super valuable experience, especially if you're trying to figure out like, do I want to go to med school? Do I not want to go to med school? Being in a job like mine where I'm not a med student and I don't plan to go to med school, but I'm in the hospital, I'm in the OR all the time, is super, super valuable information. You can learn a lot, you can meet a lot of people and kind of figure out what you want to do from there.
Awesome. Alrighty. So that rounds it up on the questions that we had prepared to kind of introduce our panelists. But if there's any questions that you members have for them, or anything that you want to ask either of them specifically, we are opening the floor to you guys if you are interested. And if you are uncomfortable talking, or if you don't want to like say it, you're more than welcome to text it in the chat as well.
I have one for Cale. What did you study on UT again? What was the name?
I'm sorry, what was the question?
What was this study for UT? What did you graduate in UT?
I graduated from UH. I went to UH and did biomedical engineering, and I just graduated this past May. So I didn't go to school at UT. I just work there now.
Oh, okay.
Yeah.
Thank you.
I have a question. Coming out of undergraduate or graduate school, is this what you expected to do? And are you happy with where you are right now in your current job?
I feel like that one applies to everyone. So if we want to go like through the list again, we can.
Yeah, so was this what I was expecting to do? Absolutely not. Like everything I'd done was medical devices, so ending up in pharma was kind of surprising for me. But am I happy with what I do? Yeah, absolutely. Yeah, it's a pretty, I like my job a lot. I like my coworkers a lot, which I think is pretty important, but I like the job a lot as well.
Yeah, I think this job is kind of almost where I expected to end up. After about like sophomore, junior area, like I knew I wanted to end up in medical devices. Location wise, I actually did not want to end up staying in Houston. But I am pretty happy with where I'm at. I love my job. I love my coworkers. We have a lot of fun, and it's really interesting because, I work with people that have grandkids, that have kids, old enough to be like my parents. But it's all really chill, they don't just treat me like a child that doesn't know anything, and that's kind of like an interesting thing to come into, we're all on a first name basis. So if I could like pick my company up and just move it to the location of my choice, I 100% would. But unfortunately, that's not a thing. So.
The job that I have is not at all what I thought I was going to be doing. Because like I said earlier, I was never really interested in research and never really thought that was something that I would go into. I do enjoy the job. It's a lot of hours. It's not regular hours. And it can be kind of stressful being in the OR so much, but it's a super awesome experience just to be in that setting and around all these people. And like I work for a neurosurgeon every day, which is pretty crazy. So this is it's not a job that I'm going to have very long. It's a kind of a stepping stone job, just kind of get my feet in the industry, figure out what I want to do. I'm supposed to be there for about 2 years. So I'm almost halfway through that, but it's a super cool experience.
So
I have a question here. So what platform you think is the most effective platform for applying for full-time positions or internships, like LinkedIn, career fairs, connections, etc.?
Personally, I like LinkedIn. Yeah, towards the end, I got premium for like 3 months just because, looking for that job. But I mean, I got my job through a career fair, so I mean, that's what ended up working for me. But I mean, I like at least 2 of my coworkers, they got it through LinkedIn. So yeah.
Personally, I don't use LinkedIn too terribly much, but I come from a different experience. I had my internship and it turned into full time. But I do think that LinkedIn is good for like initially contacting people from like different companies and kind of like making that initial step. But if you have a connection within a company, I guess I can share a friend's experience. My friend recently got hired just this week or last week at my company because he reached out to me and I sent him the head of HR's email. And so he emailed his resume and everything directly to her and was like mentioning that he's a friend of mine and kind of like gave some just like general experience that like shown that he had done research on the company, that he knew what he was talking about and he was serious about it. And so just kind of like reaching out directly to the companies can kind of sometimes be good if you can find those emails. If not, then obviously like LinkedIn is a good way of making that contact.
I think my answer is similar. I think LinkedIn is a super useful resource to figure out who is hiring and what kind of positions are available. But I tended to go from LinkedIn straight to the company's website, or like Margaret was saying, trying to find someone's email at the company instead of not necessarily applying through LinkedIn. I did that a lot, but I also went directly to the company. Then I would also say, if you're going to email someone, then I would attach a cover letter. I know it's kind of a pain in the ass to go through and write cover letters for a lot of companies, but I think like my cover letter is the reason that I have a job right now. So I think it's definitely worth it in certain instances. And even like what I did was I made a cover letter template, and then for every company that I applied to, I just filled in the blanks that were specific for that company. So it's kind of a quicker way to do it, but I think that's really the reason that I had the job. So I think that could be useful for some people.
So yeah, I
Thank
feel
you,
like a lot of
guys.
the time we underestimate like exactly how much a cover letter can do because it's so much more personal than a resume. It's just like a list of the things that you've done in your life, but like a cover letter, I feel like is just a much more personal way of saying like, this is the stuff that I love to do and this is the stuff that I'm proud of. So I definitely agree.
Yeah, and I guess one thing that I'll just add to that is whatever you do, whether it's LinkedIn, email, cover letter, resume, just make sure that it's personalized to that company. Like whatever experiences you're trying to highlight, like make sure that those are relevant to what that company does. You don't want to reach out to a medical device company and say, oh, I have all this research doing like biology stuff. Like that's cool, but it's not really applicable. So just try to like tend your resume, your cover letter, your emails to whatever company that you're trying to apply for.
Cool. Agreed. All right. Any more questions from anyone else?
I have a question. Based on what you've seen in your experience, like as a professional, are you inspired to like take a next step in a certain direction for like additional schooling or to move on to something else?
Yeah, I went to grad school. I'm not going back to school. Maybe like 5 years, 6 years, maybe like 5, 10 years from now, I'll go for like an MBA or something if my company pays for it. But if I have to take a test again, I'm gonna be so upset with myself. Um, but yeah, I mean, like, I think I don't think I'll be in the same company 3 years from now. I'm pretty sure I'll be moving on somewhere else. I think that's what most people our age at least do. Like, yeah, yeah. I think 3 years is probably the max I'll spend at this company.
Um, I mean, personally, I was very burnt out on school by the time that I graduated, so I was very relieved to be done with it. And since I had the job offer already, I wasn't too concerned about going just to get that like master's degree just to say that I had it. And since I've started, I haven't found like a program or anything that just like, or a very specific field of study that like really like motivates me to have that desire to go back. It's a lot of money, it's a lot of time, and I just, I don't have at this point like a desire to end up like in management or anything. That's not like my end goal. Which maybe I shouldn't say. I feel like that's not always a good thing, but it is what it is. And so I just feel like for where I'm at in my career, my undergraduate degree, and the experience that I have is sufficient for me. So my boss disagrees. He tried to motivate me to go back to get my master's, but then he left. So who's the real winner?
That's funny. All right, Cale.
I would say that I haven't necessarily figured out what I want to do next, but I have figured out what I don't want to do next, which is sometimes just as helpful. I've been around some people who are doing jobs that I thought I wanted to do when I got out of undergrad and realized that I don't want to do that. So that's, knocking stuff off your list like that can be useful whenever, especially like I really have no idea what I want to do after this. Like school is still an option. Finding other jobs is still an option. Switching industries is an option. Like I really don't know. And so figuring out what you don't want to do can definitely be useful. And that's something that I've experienced.
All right, awesome. All right, so we are coming up on 8 p.m., which I feel like is a good stopping point. So we might do one or two more questions if anyone has any. And if not, then I feel like this would be a good place to go ahead and conclude. Huge thank you to you guys. We really, really appreciate you three coming out and being here with us this evening. It was really nice to see your faces and really nice to see how you guys are all doing. And we wish you absolutely nothing but the best in your future prospective careers. Thank you so much for your time. Yes, definitely.
Thank you for having us.
Of course, no
Thank you.
problem.
Been fun.
We would love
Anything
to
for BMES.
Yes, and future officers, same thing for any of us. Like if you ever want a panel guest or ever want someone to just ask advice to, the old officers especially, or any old members, are always good little ways to, or good people to just ask a question to.
Someone on the chat is saying, can we connect with y'all on LinkedIn? I don't have a
Yes.
question now, but we love to ask more questions in the future.
Yeah, absolutely. Go find me on LinkedIn. If you can't, then I think you can probably find me on GroupMe, or Reagan has my email. 100% feel free to contact me however you want. It's fine.
Same boat.
Yep, same.
Awesome. Thank you guys, or all you members too. Y'all have a great night. It was lovely seeing you, and thank you so much for coming.
Good luck,
Thank you
guys.
so much.
Thank
Appreciate it.
you.
Classes.
Good luck, guys.
Stay healthy, stay safe.